Welcome everyone to our webinar. I'm Stephanie Uberall with the Council of State Governments Justice Center. Today we're going to discuss how alternative response models can support youth in crisis. And so here is our agenda for the next hour together. First, we'll frame up the problem. We'll discuss some policy and practice responses, hear about an exciting technical assistance opportunity. We'll have a robust discussion with our panelists from Colorado, Connecticut, and North Dakota on how they've been working to support youth in the community and divert them from the juvenile justice system. And then we'll have some time for questions and answers. So feel free to put questions in the chat along the way, and we'll have some time at the end to respond to those. And so before we jump in, we are the Council of State Governments Justice Center. We are a national nonprofit organization that works to improve outcomes for people experiencing the justice system and strengthen community safety. And our team is specifically focused on the juvenile justice system and improving outcomes for young people. So we work with states and counties to conduct comprehensive system assessments. And we also engage in original research and field building activities like hosting webinars and publishing briefs on critical topics that work to advance the field. And our partner on this project is the Center for Policing Equity. And I'll turn it over to Michelle Feldman, the Director of Partnerships at CPE, who can talk a little bit more about this. Michelle?
Thank you so much, Stephanie. And we're just thrilled to be here today in community with you. So Center for Policing Equity, our founders are Philip Atiba Solomon from Yale and Tracy Cassie from the Denver Police Department. And how we all got started was that about 15 years ago, they decided to team up on a project to measure racial disparities in policing in the Denver department. And since then, we've just grown exponentially. So we say that we use science to promote justice. So we analyze data from different law enforcement agencies to analyze racial bias and then to recommend policy changes. And our organization, we kind of run the whole gamut of law enforcement, academics, community engagement specialists, and scientists. And we all work together to make really to push for reimagining public safety and what it could look like. And ultimately, our goal is to make policing less racist and less deadly. And we have been in over, next slide. Our work is focused in over 30 states. We've engaged with over 60 law enforcement agencies. So we really are growing throughout the United States. And then some of our initiatives, because we've worked together with law enforcement and other groups, we've instituted policies across the country, like banning no-knock warrants, banning chokeholds, banning tear gas, and duty to intervene policies. And just to give you a quick overview of Unlocking Democracy. So this is an initiative we started. It's relatively new, but it's been pretty successful. So our goal is to unite communities and different, from elected officials to service providers, to come up with alternatives to policing programs and really provide them with technical assistance and support to do that in their communities. So you're going to hear about learning communities first. The youth diversion program is a learning community. It's made up of an interdisciplinary team that works to set up alternative programs in these 4 subject areas: college campuses, community violence intervention, crisis systems, and youth diversion. Our data connection program, it's really a collaborative, and we help the different programs to measure, use data to tell their stories and also to measure outcomes. And then the Elected Leaders Council, it's made up of different officials and their staff from across the country, everyone from the Lieutenant Governor of Colorado to New York City Council members. And we, again, try to link them with promoting policy change that makes policing safer and less deadly. Thank you.
Thanks so much, Michelle. Appreciate you being here. So jumping into today's topic, which is alternative response for young people in crisis, and really thinking about why this is important. So across the country, we have seen that young people are facing an urgent mental health crisis. We're seeing, this being reported extensively in the news. Experts are raising flags and declaring this a national emergency. And research is showing us that young people are being hospitalized more and more for mental and behavioral health reasons. And this is obviously very concerning, as we want our young people to be healthy and able to access supports in the community so they don't end up in higher levels of care and facing more intense needs. And further, we see how young people with behavioral health needs enter the juvenile justice system as a result of these needs, either, from being in a crisis or parents desperately trying to get their child's needs met, but can't access services without justice involvement. And simultaneously, we hear how juvenile justice systems continue to report how youth with behavioral health needs are a primary concern for their system, and are overrepresented and don't really get access to the care they need, and instead are bouncing between detention, hospitals, and the community without continuity of care. And so given all of this context, of increased needs, justice response to a health need, gives us an opportunity to really rethink how we're responding to youth's health needs and who is responding. And so we know that the juvenile justice system is acting as the backstop, but we should really consider how an alternative response like youth mobile crisis, community assessment centers, credible messengers, family mediation, and others can really effectively support youth in crisis, help maintain them in the community without entering the juvenile justice system. And so what can we do to respond to youth health needs more effectively? So first, we can work to establish models that provide young people with an effective, appropriate response to the situation they're in that really works to center their health, instead of having a public safety response to a health concern. And this can really work to create stability, maintain safety, and connect young people to long-term care while keeping them in the community. And critically, it's not enough to establish new approaches. We have to match these models with policies that require their use, and that intentionally works to keep youth with behavioral health needs out of the justice system. As when young people experience the justice system, they also experience disruptions and instability. Things like school and health coverage, therapy and medications, relationships, and other supports that help maintain a young person's mental health. And so we don't want our interventions to further compound the original reason why young people might have needed an intervention in the first place. And so taking a systematic approach with policy change can really ensure that these responses are available to all youth, and not just a select group, which can further exacerbate inequities across race, geography, and ability. And so to ensure we're promoting equitable solutions, it's really critical to consider how impacted youth and families are engaged in solution building and decision making. So up here, I have a visual that really, I think, showcases a nice continuum of how folks can be engaged in the work. And so just asking you all here to reflect where along this continuum your initiative falls in partnering with youth and families. And consider how you can further advance this partnership in order to have more informed solutions that translates to real outcomes for people. Sometimes as system leaders, when we don't involve the people we're serving, we can miss the mark on what youth and families really need to succeed and be healthy. And so I wanted to share a few examples of how states have worked to implement alternative response models. And we'll hear from our panelists about the work they're doing in more detail in their states and counties in just a few minutes. But I also wanted to explicitly state that these are all youth-specific responses. So I know that there's a lot more states implementing mobile crisis, co-responder models, community responder models, but these are really centered on youth. And so just wanted to share that with folks. So I'll highlight these quickly, and you can learn more about these approaches in a brief that we just posted, and I'll share that link in the chat in a few minutes once I take the slides down. But here you can see Massachusetts has a mobile crisis intervention that works 24/7 and is available to children and families to conduct assessments and also connect them with long-term care. Massachusetts also has a school mental health-based initiative that works to support young people in schools. And so you'll see also the thread of school-based responses throughout some of these examples today, just because obviously young people spend a significant amount of time in school, and schools can also be a referral source to the juvenile justice system. So want to make sure we're showing up everywhere young people are present with an alternative responder model. And here we also have Nevada, who operates a children's rural mobile crisis response and works to partner with detention centers, schools, and hospitals to support young people in crisis and aftercare through telehealth and others. So again, want to highlight our rural counties and states that are working to implement an alternative responder models, as I know resources can look differently in our rural and frontier counties, but just showcasing what is possible, especially now with telehealth. New Jersey also has a mobile response and stabilization initiative for youth under 21. And so family members can request this and they can receive up to 8 weeks of follow-up. Oklahoma also has a youth mobile crisis initiative for young people up to 25 years old, and also provides follow-up with teams made up of peers and paraprofessionals with deep community ties. So highlighting, a credible messenger aspect of the mobile crisis and follow-up team. And Wisconsin has also implemented a school mental health framework with a wide range of components to really ensure young people have significant mental health supports in schools. And so because we want to support states and counties in advancing this kind of alternative response for young people, under this initiative with the Center for Policing Equity, we're offering free technical assistance to 2 jurisdictions, can be states or counties, and just want to provide technical assistance to support you all in developing an alternative response model that works to divert young people from contact with law enforcement and the juvenile justice system. And so through engaging with us over a 9-month period, you can expect that this will result in outlining the components of your alternative response model, identifying and updating policies, and developing an action plan that leads to strong implementation. I will put the link in the chat that outlines kind of this technical assistance opportunity and the deadlines and things that we need in order to submit a letter of interest. And so we're asking jurisdictions to put together a team that includes decision makers to be able to share data and policies with us and really be committed to system change and implementation of an alternative response model for youth in crisis. And so to be considered for this opportunity, we're asking sites to submit just a short letter of interest by September 27th that outlines your goals and commitment to implementing an alternative response model, describing who will be on the project planning team and how leadership and other surrounding stakeholders will be involved in the project, and what data and policies are critical to advancing this new approach. And so This is a really great opportunity to get support in implementing a new approach for young people in crisis. And I would be your TA provider. And so I'm very much looking forward to partnering with jurisdictions on this important work. Again, I'll put the link and my email in the chat in a minute, and please feel free to reach out to me with any questions. I'm happy to talk about the initiative or the letter of interest. Just feel free to connect. And so now I'm going to open up for our panel discussion. And so bear with me as I stop sharing my screen and kind of move around here. One second, everybody. Okay, so thanks so much to our great panel today. So we have Yecenia Casiano, who is the Senior Project Coordinator from the Child Health and Development Institute in Connecticut. We have Cory Pedersen, the Director of Children and Family Services Section from the North Dakota's Department of Health and Human Services, and Sarah Troy, who's the Executive Director of the Juvenile Assessment Center. Thanks so much for being here today. So I'll start with Sarah from Colorado. Can you just share an overview of the community assessment program, how it got started, and how it's evolved over time?
Absolutely. And thanks again for inviting me. So I am the Executive Director of the Juvenile Assessment Center for the 18th Judicial District in Colorado, which I think is important to note because there are assessment centers actually across the state of Colorado. And we all do things a little bit differently, but just to kind of point that out. So we're fortunate enough that we have a prevention program within our assessment center that we call the Community Assessment Program. It is a clinical-based program that we provide free clinical screening and assessment for school-aged youth, so anyone kindergarten through senior year who is referred to that program. It's totally free to participate in our screening and assessment process, which is fantastic. And it was really born out of this idea of working with youth prior to them being involved in the juvenile justice or child welfare systems. And so for any of you who know how assessment centers kind of work in the state of Colorado, most of them work solely with law enforcement transports. So those youth who are being charged or coming into contact with law enforcement for whatever, it could be a non-offense like runaway all the way up to state level charges. And around 2009, 2010, we started having internal conversations about why we weren't trying to do more to prevent that. Why were we not intervening earlier as opposed to waiting until youth came into contact with law enforcement? And so we actually, as an agency, became a nonprofit in 2009 because we knew if we were going to have a prevention arm of our assessment center, we would need it to be grant funded. So we became a nonprofit in 2009 and then kind of slowly started building out this program. This idea of being preventative. And so at the time we were actually housed inside of a jail, which was not a very family friendly community space. And so our numbers were kind of low. We had a few referrals coming in from schools and things of that nature, but it really wasn't a very busy program. And we knew that was because of our location, right? We had a lot of families who were not willing to come into a detention center or a jail, and rightfully so. Totally understood that, especially with prevention work. So we moved out of the jail and into a brand new building in 2016, the beginning of 2016. And I would say that's really when our program kind of took off and started and kind of became the program that it is now. So at the time, it was just a kind of a small and mighty team of 2.5 of us. We had 2 full-time staff and a half and a part-time staff member. And we were just taking referrals from schools pretty much. I mean, we had a few referrals coming in from some other entities, but for the most part, it was really just working with schools. And taking referrals for youth who were starting to struggle with attendance, with maybe some discipline behaviors at school. Maybe mom and dad were coming into the school and asking for help because of some things that were happening at home. It was really just kind of this smaller group of youth. However, when we moved out of the detention center and into our community-based location in 2016, the program really exploded. And I can't stress enough just how much it exploded when we were in a community location. And so that program now houses about 10 different clinicians. We are kind of all over our judicial district. And so for those of you who maybe know Colorado a little bit, we're kind of the south and eastern suburbs of the Denver metro area. So we have staff that are co-located in schools. We have staff that are kind of in all of our 4 counties. We really try to be out in the community in order to work with youth, as opposed to always making them come to us. We are the biggest judicial district in the state of Colorado, so we're not exactly close for a lot of families, and we don't want to put the extra burden of transportation on them if that's not necessary. So we have staff kind of located throughout our judicial district, but we also travel into schools to do these assessments as well. We don't do anything in home at the moment. It's all community-based work. But that's okay with me. We are plenty busy with that work. So I would say just kind of a bigger overview. Like I said, it is clinical. All of our staff are licensed clinicians. They're doing screening. They have access to about 51 different screening tools that they can use that range from behavioral health to human trafficking to substance use to school refusal. There's just a plethora of screening tools that they can use in conjunction with their assessment, which we call a biopsychosocial assessment, that really is trying to get to the root of the problem. So we also do a sit-down interview with the parents and kind of get their perspective, development history, any kind of service history that they've had, what they're seeing home, community, school. And then we meet with the youth privately, no matter the age. And I always make it a point to say that because we work with school-aged youth, right? Kindergartners are coming in and being assessed by us. And I think it kind of surprises people sometimes that we meet with them without their parents. But it's really important that we are getting the youth perspective, no matter their age. We really want to hear from them. Obviously, an assessment for a 5-year-old looks very different than an assessment for a 16-year-old. But it is a clinical-based assessment, so really trying to get to the root of that problem and then doing direct referrals for services. And so because they're licensed clinicians, they can say this youth needs something specific like EMDR or outpatient or whatever it may be. And then we take their insurance, their location, and the treatment need that they have, and we make direct referrals for services. So instead of saying, hey, it would appear that Johnny could benefit from some mental health treatment, here's 15 different places in the metro area you can call, we take that on and we say, based on the insurance or lack thereof by Johnny and what his treatment need is, we're making a direct referral to this agency. Because we all know that asking parents to call 15 or 16 different places to try to get their youth or their child some help, it just isn't going to work. It's too much to put on them when they're dealing with crises. And so we just kind of take that on. And then we also provide follow-up post-assessment. So we're really making sure that we're getting that connection to the service. So our staff stay involved for as long as it may need for that youth and family to connect to those services. Some families, it's 2 weeks, 3 weeks, a month. Some families, it's 6, 7, 8 months. It really just kind of depends on their level of need and how much work we need to kind of help put in with them. A little bit. And we actually have a really high engagement rate. We typically are anywhere between 85 and 92% of resource engagement, meaning that 85 to 92% of our families are following up and engaging with the resources we're providing them, which, as we all know in this field, is very high. We're very, very proud of that engagement rate. We know that the work that we're doing is working and that we're getting youth connected to the right service the first time, and really making sure that those needs are being met in order to hopefully keep them out of the juvenile justice and child welfare systems. We also take referrals from child welfare, and I said earlier that our program exploded. I really mean that. We take referrals from lots of different entities at this point. I would say schools are still our top referrer, but we also take a lot of referrals from child welfare, from hospital-based systems, so those youth who are coming in to be evaluated for possible M1 holds. We take them from law enforcement if they're responding to a home and maybe that child is not being charged with something, but clearly something is going on. There's really nowhere that we haven't taken a referral from, and we really just want to make sure that we're being impactful in the community. So those referrals can really kind of come from everywhere, and we work collaboratively with all agencies within our communities to make sure that those youth are getting access to those services. Obviously, sometimes youth can't afford to pay for those services. They may not have insurance. We have some relationships with our child welfare departments to be able to get some of that preventative work paid for. We also have some contacts with different pots of money that we can access to try to get services for free or a very small sliding scale fee. So it really is important to us that we're looking at that. And then I think the other important thing to note is that we want our process to be a holistic. So it's not just behavioral health, right? We're looking at their education. Do they need something different in terms of educational environment? We are looking at pro-social activities, mentoring, and another big piece of what we do is basic need connection. So a lot of families coming in that need access to food, clothing, shelter. Obviously, we all know that without access to those basic needs, getting access to services like mental health and substance use just are going to be a lower priority for those families. And so we want to make sure that we're accessing those services, helping them apply for Medicaid if needed, whatever it really may need for those families to get connected to services. We want to make sure that we're doing doing with families. And I know I already said this once, but just to point out again that it is free. We do not charge at all for our services. We write grants to support that program and have contracts with some of our school districts, child welfare, different entities like that to continue to have those services paid for free. So that's kind of the overview of our programming and why we started.
Thanks so much, Sarah. I appreciate you sharing that. The referral, retention, and success rate is really high. Do you have any internal processes that you engage with to make sure you vet providers or like make that strong referral connection? Because I think that handoff is always really tricky. So curious if you all have anything to share with folks on the line about what's helping create that success.
Absolutely, and great point. So our community assessment program is also in charge of creating our resource list. And resource lists in general, I actually really struggle with because they're really hard to maintain, right? Things change, as we all know, they change on a daily basis. Some providers stop accepting certain insurances, or they close down, or they change their model of practice. And so it's really important that we're staying on top of what the resources are in our community and being an expert in what those resources are in our community. So our clinicians are in charge of kind of keeping that database, which is electronic and is updated, I say, on a daily basis. So they go out and do a lot of site visits. We won't refer to anybody if we don't know what their building looks like, kind of what the parking lot might look like, what the front desk looks like. That's a really important thing to us. So we do a lot of site visits. We obviously call and make sure that we're staying up to date with what their wait lists are looking like, what insurance is there, accepting things of that nature. And so we're updating that in real time. We initially, when we kind of started our resource list back in the day, it was a Word document, like I'm sure most people have, right? It was something that was very hard to keep updated, but it got so big that it was actually really hard to keep track of. And so we kind of started fresh, and I would say about 2017, 2018. And we now will not put you on our resource list unless you request to be on it, or we've met with you and have done that site visit. We have a point person that we can call and talk to. We have people that call and request to be on our referral list all the time, which is fantastic. But again, it's really important to us that we're making those connections with agencies that are actually going to take those youth on, that are going to work with them and their families. It's going to be a positive interaction for them. We will take people off of our resource list if we're getting negative feedback or they're refusing to update us with information. So really important that we're keeping that up to date. And we do keep it electronically within our client management system. So our staff can search by insurance, they can search by location, they can search by treatment modality, whatever it may be, they can search that way. And it's, again, we don't want to just like have parents cold calling. We want to do some of that initial legwork to make sure that their insurance is going to be accepted. We don't want somebody waiting 8-9 weeks for services when it's really important that they're getting in the next week. And so we may have to move to a different provider, which is totally fine, right? Everybody's kind of different in terms of how that works within their agency. So yeah, that is something that we take a lot of pride in, as well as making sure that those connections are the right connection the very first time that we're making it.
Thanks for sharing that. That's like really amazing work you guys are doing that facilitates, I think, trust too with the young people and families. So you're not just kind of sending them off and saying good luck, and
Absolutely.
get through all the things. So thanks, Sarah.
Thank you.
Yecenia, can you talk to us a little bit about the efforts in Connecticut around the school-based diversion initiative and the youth mobile crisis?
Sure, thanks, Stephanie. So in 2008, the MacArthur Foundation Models for Change Mental Health Juvenile Justice Action reached out to the Court Support Services Division, the judicial branch here in Connecticut, to address the increasing rates of school-based arrest. So CSSD reached out to us to co-develop the model. Currently, we're funded by the governor's biannual budget through the State Department of Education, who contract us to do the work with the schools. So we developed the SBDI model, School-Based Diversion Initiative, and it's a school-level initiative. It's designed to decrease arrests, suspensions, and expulsions and connect students to appropriate mental health supports. We want to keep students away from the juvenile justice system. Since 2009, SBDI has served 73 schools across 26 Connecticut school districts. We also have reduced core referrals by 29% and connected 55% more students to behavioral health services. The model helps kids stay in school, improve their student outcomes, and ensure that they receive fair and equitable in-school discipline, regardless of any mental health or special education needs or demographics such as race or ethnicity. The goal of the model is, one, to reduce the number of school-based arrests, expulsions, and out-of-school suspensions, and also to build knowledge among the school teachers and school staff, SROs, and really recognizing and managing behavioral health crises in the school. The other goal is to link the youth who are at risk of arrest to appropriate school or community-based services. And we do this through our core components, which are professional development, community coalition, and discipline policy consultation. Additional components of the model include restorative practices, youth and family engagement, where we assess where schools are with their engagement with families by doing some community conversations with school staff, as well as parents and students. We also provide training to law enforcement. So that's our law enforcement engagement component. And we work with our youth service boards and juvenile review boards. Our schools have benchmarks they must meet. They have to decrease by 25% in school-based court referrals, and they have to decrease by 25% their in and out of school suspensions and expulsions. And then they have to have a 25% increase to mobile crisis intervention services or other appropriate school and community-based supports. So we work really closely with our mobile crisis intervention services, and it's a big component of our model. Mobile crisis in Connecticut is the component of Connecticut's behavioral health system. It's available for free to all children in Connecticut up to the age of 18. It's a service for children and adolescents experiencing behavioral mental health crisis that is accessed by calling 211 info line. It is funded by the Connecticut Department of Children and Families, and it partners with United Way of Connecticut 211, who are the ones who receive the call. And then they partner with us here at CHDI because we house the Performance Improvement Center for mobile crisis. The Performance Improvement Center was established in 2019, and it was really established to support the implementation of best practice models for children and families. Since then, the PIC has provided data analysis, reporting, quality improvement, as well as establishing a standardized workforce development across all our providers and standardized practice development. The PIC is responsible for submitting monthly, quarterly, annual reports. We're very heavy on data collection and summarizing findings on key indicators of our mobile crisis service, access, quality, outcomes, and we take a lead role on quality improvement activities. DCF has also has us as CHDI take the lead on practice development and outcome evaluations. Mobile Crisis has a team of about 150 trained mental health professionals across the state that respond immediately by phone or face-to-face within 45 minutes when a child is experiencing any emotional behavioral crisis. Like I said, the purpose of the Mobile Crisis program is to serve children in their homes and in communities and reduce the number of visits to hospitals, to emergency rooms, and divert them from hospitalizations if a lower level of care is safe and effective alternative. The crisis is defined by the caller. For us, the clinician will meet the youth anywhere in the community and continue to work with them for up to 6 weeks to develop a long-term care plan. And as of this January, a Mobile Crisis has expanded to 24/7, 365 days a year. So we go mobile 24/7. We have a total of 14 mobile crisis sites collectively provided coverage for every town and city in Connecticut. And we have a rapid response rate of 90% of mobility to respond to these calls. And then when the clinicians do respond, they provide crisis stabilization, assessment, brief treatment, like I mentioned, up to 6 weeks, and develop a care plan and link them to other services. The main goal is we want to maintain youth safe in the community and eliminate unnecessary emergency department visits or subsequent inpatient admissions. And also, as part of the continuum of care in Connecticut, we recently have the UCCs, the urgent care centers, that are now available for families of children who are experiencing behavioral health crises that do not require an emergency department level of care. And that as well is funded by DCF. And the centers function as walk-in clinics, providing youth and families with immediate access to resources. While if they're experiencing a behavioral health crisis, such as thoughts of suicide, self-injury, depression, anxiety, or out of control behaviors, and they work closely with our mobile crisis teams as well. So that's what's happening in Connecticut.
Thanks so much. And you all actually have an evaluation of the model, correct? That demonstrates
Yes.
some of these outcomes?
Yes, yep, we recent yeah, a couple years back did a evaluation of the youth model that demonstrated that 25% there was a 25% reduction in subsequent emergency department visits by utilizing mobile crisis. Yeah.
That's just like such an important, I think, piece for the field, because we often don't have, you know, strong evaluations on prevention and how this really does help keep kids out of the hospital when they're in crisis. And just, you know, from your work with schools and mobile crisis, like curious what you think the impact this has with young people and like on the juvenile justice system in Connecticut.
Well, we're really, really trying hard to keep kids out of the JJ system. So I think this is, an awesome opportunity for us to have this program, this SBDI, to prevent kids from entering the JJ system, and by working with the school systems and providing them that additional professional development that they're probably not receiving in terms of the professional development that we work with schools on are on recognizing adolescent behavior, recognizing child trauma. We also work with teachers on vicarious trauma, so we want school staff to be able to respond to the kids' behavior, but in a different way, and limit them from having to, when a child is having a crisis or having a behavioral health issue, automatically calling down to the office and making a referral to calling 911 and the police and so forth. So we're trying to make sure that our schools are trained, get the training that they need. Like I said, we look at their discipline policies to see how we can help them look at different ways of their policies by incorporating restorative practices so that we can keep kids out of the JJ system.
Thanks so much. And I saw there was a question in the chat about like what did the study use to prove future emergency visits were prevented? I posted the link to the evaluation in the chat, so take a look at that. If I remember correctly, young people were matched, those that received the intervention versus those that did not. And they were looking at young people who did not receive the youth mobile crisis intervention and their hospitalization rates among the two cohorts of matched young people. So pretty extensive, thorough evaluation there. Feel free to check it out. Follow up with any other questions. Happy to answer for folks on the line. Thanks, Yecenia. Yeah, of course. Cory, thanks so much for joining us. Can you share with us some of the statute changes that have happened in North Dakota and why these changes were made?
Certainly. Thank you, Stephanie. Again, Cory Pedersen. I'm the Director of Children and Family Services for the state of North Dakota. Back in 2019, the legislation put together a juvenile justice commission, and part of their role was to really rewrite and look at the juvenile justice laws in North Dakota to really talk through what children should be referred to the juvenile court for any sort of diversion or probation through JJ, and which ones need to be taken out and brought to a different, either another agency or a nonprofit. And so part of that, there was a lot of changes in that law. The piece that I'll be talking about today is the piece that child welfare did inherit, which is what we call the CHINS, which is a little different than most states. It's children in need of services, not supervision, but services. And what we've done is the rewrite really took those status offenses, as we would call them, truancies, so referrals from school, children misbehaving in school or in crisis in school, crisis at home, running away from home, all those offenses that used to be in the juvenile justice and go to be cited and go to the court, now is in the child welfare universe. There was two pieces of why that happened. We are a state supervised state for child welfare. One was to avoid unnecessary juvenile justice involvement for those kids. We also knew in North Dakota 2 data points that we thought were important, which was 85% of the children that were cited for those offenses or were already in the child welfare system. So they were already in or known to the child welfare system. So bulk of them were already working with the agency. And so what we did was we deployed the work and got an intake team to really take a look at how schools and parents, and if necessary, law enforcement who maybe have found a runaway where a child wouldn't be cited, but they would be referred to what we call the CHINS team in our state to intake and to divert those folks to possible services. We also have just started the regional mobile crisis team out of that work. The other piece why that was important to change out of JJ into child welfare for the state of North Dakota is we have access to the mobile crisis team probably since we fund it. We also have set up certified shelter around the state. That is basically a shelter where children can go in crisis or their families can support the place in crisis for up to 14 days in those shelters. We do have screening and assessments for those children. Most of that is not the behavioral health service that they need, but it'll be a screening and an assessment to see what services we need to navigate them to. And so most of the work that we did in the law was really divert in law those citations that used to be truancy, ungovernable behavior, unruly, runaway, tobacco, curfew, out of juvenile justice altogether. In North Dakota, of course, size is kind of important to note. We're a small state, very rural, but that took about 3,500 youth out of the juvenile justice system immediately. And so what we did was when we rewrote the law and policy, we gave it 1 year delayed implementation. So we just kicked this work off of this legal changes in July 1 of 2021. And so that is just a new change in our law. So we have had a lot of collaboration with Council of State Government, but the real work is around the agency work, which is the juvenile courts and their probation staff, the child welfare staff in the state, and the collaboration we did with the Department of Corrections juvenile side. Those 3 entities really worked very hard with legislators and policymakers around why it's important to keep this bulk of children outside of juvenile justice, away from probation, away from detention. And that policy and law then has really shifted the focus on those kids to get behavioral health services, screening and assessments timely. And we do have it where we have a matrix where they are given a level of intensity. And so most of them that fall in the mediate or high intensity level for chronic behavior, we do have a 6 to 12 month follow-up with those families. And so we're checking in with them. We do not have them come in, we go to them. We guide them to the service and we help support the families wherever they see the need, but it's family led. And also that is spun out of this work is what we call family-centered engagement. So we have an independent facilitator that can bring the family in where the family can make a plan for safety for their kids outside of child welfare, outside of the courts, and they can make their own plan. And that support is by our team that will support them to the right services at the right time when they need it. What we found in the law change is it's just a philosophy in where these children really could get a service, I think, more timely and the right service at the right time. And so even though we still get law enforcement referrals to this process, most of them come from our school folks, our principals, our teachers, and parents that are concerned when their children are in crisis.
Thanks, Cory. Appreciate that background. And if I remember correctly, there was also some changes around education diversion from the courts as well.
Right. Yep.
Can you speak a little bit about
I
that?
can, yeah. So the other part of that law, which just went into effect as of this August 1st, was that low-level misdemeanor cases in schools, mutual fights, disorderly conducts, cannot be referred to the juvenile court any longer as of August 1st of 2023. There is, our higher level offenses in schools, weapons, drugs, can be referred still to the juvenile court. I do not work for the juvenile court any longer. I used to be a director with them, but it really has, again, shifted the focus around what services does the child need? What supports can the school offer? Who do we need to send to the school where the kids are so we can support their needs from a behavioral health standpoint, as well as not putting them in the juvenile justice system based on mutual combat fighting or low level, as we call it in North Dakota, it's disorderly conduct where basically it's harassing or annoying someone, which as my mom would say, I did that pretty much for the first 30 years of my life. So it's one of those laws we've looked into in North Dakota changing altogether, but it really puts the onus on if the school has issues in the school, they have to try to address it first, just like truancy. If they try to address it and the parents are uncooperative or the behavior continues to criminal level, then they can have a referral to the juvenile court. But the school has put in interventions where they can support the children in the building with resources, with restorative justice, with other programming needs, without having to refer them off to the juvenile justice system. And that, like I said, just started this school year. So we are right in the heat of these conversations. I think one of the most important things with these kind of big law changes is constant communication, having good relationships at the very local level so that if school administrators are frustrated or seeing things that they're not sure are working or that they need supports, that they can go to their local jurisdiction and talk about that. And we have set up many areas that have school resource officers that have collaboratives that meet with juvenile court, child welfare, and just talk about certain things that are going on in a local level, because we know we can make a lot of state law and policy, but really the drive of change comes at a local level with having good relationships, having good services, and really, walking in step with your partners every day.
Thanks so much for sharing that. And I appreciate the state local dynamic and that this is all getting implemented right now as everyone's going right back to school. So I'm definitely interested to see how it goes and, the challenges that come up and how you guys navigate it. One thing that you all really talked about, which was, I think, a common thread, was just like how the interventions are really led by the family and the young person, like they get to define the crisis and, you're responding to them and you're going to them, and how that's really, centering families and young people in the intervention versus like system centered. And so, that's a shift in the way that in which we've worked with young people and families, I think, over time. And so just reflecting on that piece, and then wanted to open up for, any questions from folks on the line, please put them in the chat or the Q&A box. Would love to hear any questions you have for our panelists or about the TA opportunity, but also wanted to ask our panelists, this is like a shift in philosophy, I think someone said before, and how we're responding to young people. And just curious, like who were some of the first people at the table? Who did you need to get buy-in from and like help change hearts and minds around this stuff? What were some of those initial steps you might want to share with folks that are looking to take this kind of work on?
I always start with, just because of a lot of changes we've done through either our dual status work or other things in North Dakota. It really starts with having, common values and mission to what we want for our children. And so I think if you get around the table with law enforcement, schools, nonprofits, service providers, if you all have a common goal, I think if you come to it with the intent that everybody wants to do really good things for children and keep them safe and healthy and educated, I think if you start at that premise and you have that base, I think you can make certain changes. There's always going to be things you need to adjust. And I think you have to go into it knowing that you're not going to be perfect out of the gate. But if you stay on the mission of what the common goal and values are for kids, I think, and keeping the child and family in the center, I think you can get a lot of work completed on the right side of things.
I think for us too, another important piece that we found when we were developing this program is making sure that we weren't reinventing the wheel, that we were going to be providing a service to the community that was needed, and that didn't currently exist, which we found to be the much easier route, I think, to start this program, was getting the right people around the table, knowing that we were doing something different or wanting to be different. We had no idea what was going to happen when we tried to start this program. But sitting down with members from our board who were from law enforcement, the schools, child welfare, all the same agencies that you discussed, Cory, and just saying, this is what we are wanting to do. This is what we think the community can benefit from. What are your thoughts? And getting that buy-in, and yes, to Cory's point, making sure that everybody's there for the right reasons, the right goals. Everybody wants to help youth. They want to keep them out of the system. It obviously works much better for society and community in general if we can keep kids out of the system. And so how do we work to make that happen from a collaborative effort, right? Knowing what we would need from partners ongoing was a really important piece of that conversation too. Just letting them know, not only do we want you to refer to this program, but this is what we might need on the back end after assessment, and having that buy-in was really, really helpful to get this program kind of up and running and off the ground.
We agree. I think for us in Connecticut, especially with the school-based diversion initiative, it was really getting at the beginning, getting all the state agencies on board and buying in to the work, and then so that they can help us sustain the work moving forward. And then of course having families at the table and school systems at the table, and youth, so that we can hear their voice, because a lot of times we do things for youth and families, but they're never at the table. So we want to make sure that part of our models that the youth and family are always at the table and that we hear from them.
Thanks, everybody. I appreciate all of this. There's a question for Cory in the chat. How did you get the legislature on board with youth-centered juvenile justice reform?
Yeah, it's a great question. And I think it really started with them giving them the idea of where things were going with, our detention screening tool, and what we're seeing with our disproportionate minority youth, Native American youth in foster care and in detention, and showing them the data first. And then they crafted the bill to start the Juvenile Justice Commission, and they actually sat on it. They picked their own chair, they led it, and we've got them bought into letting practitioners meet with them every month to really craft out what is working, what isn't working. CSG coming in and giving us some support, technical support on what other states have tried, what other things have worked. But really they drove it because they formed the commission. And so in North Dakota, we are a citizen legislation. So and we meet every other year. So we're fortunate. We're not in session every year with legislators, but they're citizens. So a lot of them are families, farmers, teachers, and we meet for 4 months. But they worked and formed this Juvenile Justice Commission because I think they were passionate. We got the right people on there, but it was their bill. They formed the commission. They picked the members. They helped write and craft it and sell the idea of this reform. And I think that was probably the selling point. They worked on it every month for 2 years. And it was really their piece that they wanted to contribute to the state. So I think that's part of it. And we had both Republican and Democrat on the committees. We are a very red state in our state, and I don't mean to be political, but we had more Republicans than Democrats on there, which was intentional. But I think it was helpful that they bought in from the beginning that Juvenile Justice Commission, they wanted to learn about why our detention rates were poor, why our minorities are sitting longer in detentions and in foster care longer. And so them wanting to learn, showing them the data, and then them crafting that this was their commission, I think really got the buy-in from them.
Thanks, Cory. And I think to just plug that as well as like the data really speaks. And so, when you have good data, you're able to showcase the problem from an objective standpoint and really then target some of these decision points and say, hey, how can we be doing better? What's driving young people into detention? Are these really public safety risks, or are kids in a crisis, or are parents at the end of their rope? And you're able to really then kind of parse what the problem is and then design the types of models you all are talking about today, because then we can really have some, objective conversations about why and who and what is driving law enforcement contact or detention use or involvement in the system. And so I think that really also helps with legislative initiatives, like Cory was saying.
Stephanie, if I could just add one other piece, we have ongoing forums for how it's going now. So we're meeting with schools for the next 2 months, just reminding them of the law, getting their feedback. We meet with the SRO Association. So this, even though it's kicked off for the last couple of years, these changes, we're going to be meeting with the stakeholders and the public and the providers ongoing probably for the next 5 to 10 years, because we do have to adjust the law if things, public safety becomes an issue. So we'll be watching for those things.
That's great. And I think, like, I've heard all of you talk about, the ongoing engagement with various stakeholders and how important that is, just around maintaining relationships, and advancing the intervention and the policies, to really kind of quality check, how are we doing? And so that's our job, right? On our end is to say, okay, let's, like the quality assurance that Connecticut was talking about, Sarah talking about, referral partners coming on and off the list, and just all the different ways in which we can continue to improve, because we're definitely not going to get it perfect ever, right? And so how do we just continue to adjust and really do the best we can for young people and families? And all of this really leads to stronger safety, right? When we're able to really understand what's driving kids into the system and work to meet their needs more effectively. So any closing questions from the audience? Any closing thoughts from our panelists on anything you want to share or you heard today from others you wanted to drop in the last 2 minutes we have? Don't see any other questions in the chat. Well, I appreciate all three of you being here with us today and sharing the great work you're doing. I want to just plug the technical assistance opportunity one more time. Please get your letters of interest over to me. I'm happy to meet with folks. I think this is such a great opportunity to get some support. And really thinking about how to stand up an alternative response model for young people in crisis. It will help serve young people more effectively, build community-based supports, and really help divert young people from law enforcement and juvenile justice contact. So thanks so much to everyone for joining us today. Thanks to our panelists, and thanks to everybody who's working to just improve the lives of young people that's on the line. Appreciate you all. Thanks, everybody. Have a great day. Thanks.
Thanks, Stephanie.
Thank you.
Bye.